The people here are no longer afraid of the bullets. They've learned to live with war, starvation, and cholera. And now there's a new threat, one that's shattered the world's most developed countries: coronavirus. In Yemen, the first official case of COVID-19 was announced on April 10th. Since then, scores of cases have been detected across the country, where half of all the medical facilities have been destroyed by war. The Kuwait hospital is still operating. It's said to be the best equipped in Sanaa to receive patients with COVID-19. The BBC has gained access to it. Nurse Samira knows how dangerous the virus is in such a fragile health system.
مستشفى الكويت الجامعي المركز الرئيسي لحالات الكورونا يوجد العناية 16 إذا قدر الله وأتت الجائحة لمن ستكون 16 قدر الله حصلت الكارثة المتوقع أن نستقبل أول مرحلة أول 16 واحد بعد 16 نقول لهم عفواً.
There are only 200 ventilators for a population of nearly 30 million people. The Houthi movement based in the north of the country has only announced 2 cases and 1 death in Sanaa. But our sources tell us that the situation is more dire, that there have been scores of COVID-19 cases and deaths in Sanaa alone. And the UN warns that the virus could be spreading undetected in Yemen. Whilst reporting on the coronavirus has been banned by the authorities, videos like this one have been circulating on social media. Yet across the country, there have been few containment measures to keep the pandemic at bay. In some neighborhoods, mosques were closed and markets shut down. But others are still terrifyingly crowded. Here in this quarantine center, health workers are scrambling to prepare for a feared influx of COVID-19 cases.
الدور الأول جاهز و4 أدوار غير جاهز. كذلك نحن نفتقر إلى شحة المواد الوقائية للعاملين. أكثر من 10 أشخاص في حمام وأكثر من 3 إلى 4 أشخاص في غرفة واحدة.
There is so much to do in a country that's already the world's worst humanitarian crisis. The people here are acutely malnourished. Cholera and diphtheria waves have ripped through the country over the years. It's left the population with one of the lowest levels of immunity to disease in the world. That's not all. Clean water is a scarce commodity in Yemen. Washing hands, a simple rule to prevent the spread of infection, is almost impossible. More than 24 million people survive on humanitarian aid. That's been hampered by the Saudi-led coalition de facto blockade. And now, American aid officials decided to halt funding, cutting off about $70 million in assistance destined for people in the Houthi-controlled northern part of the country. US aid says the Houthis are to blame.
So we know that the US has pulled a lot of its humanitarian funding to northern Yemen. Tell me what impact that's going to have on the coronavirus response by NGOs in Yemen.
Yemen is particularly unique to COVID-19. And already in Yemen, to deliver aid to help prop up failing health systems, the authorities have made it incredibly difficult and it tried to interfere in our work. Where there's a risk that aid isn't going to go where it's supposed to go, end those programs and keep the aid flowing to people who need it most. Otherwise, it's Yemenis who are living in fear of COVID-19 who will suffer the most.
Despite a ceasefire designed to help the country focus on containing the virus, fighting has continued. This war has brought Yemen to its knees. And now, with a deadly pandemic, there is no sign of relief for the people here. Nawal Al-Maghafi, BBC News.